Helping patients diagnosed with cancerous brain tumors. Tonight, News4JAX is exclusively taking you into the operating room to show off a fairly new treatment.
I think it's going to be a major game changer for patients who have tumors that have spread from elsewhere in their body.
May is actually National Brain Tumor Awareness Month, and we want to warn you there are images of actual brain surgery in this story. News4JAX reporter Eric Avane joining us live tonight to explain gamma tile therapy.
Well, Kent, this is a FDA-approved procedure that will not cure brain cancer. However, it helps those or some with brain cancer to live a little longer with an improved quality of life.
It was very scary.
Robert Vigil underwent brain surgery to remove a cancerous tumor. Although he received traditional radiation therapy following the surgery, the tumor grew back from cancer cells the radiation did not destroy. So he came here to Orange Park Hospital, where neurosurgeon Dr. Michael Horowitz performed a fairly new FDA-approved procedure.
He says, well, I can help you. And I said, let's do it.
I took out the tumor that had grown back, and then in the area where I took the tumor out, I then put the gamma tiles in to just give local radiation to the cavity and the wall of the cavity where I took the brain out.
To me, it was a release on life because I'd never heard of it before.
Typically, when a cancerous tumor is removed from the brain, a patient will still undergo radiation and/or chemotherapy to destroy cancer cells that are left at the site of the tumor removal. But patients can only receive so many rounds of radiation or chemotherapy. This is where gamma tiles come into play. These thin, wafer-like tiles infused with radiation are inserted into the area where the tumor was removed.
It's a low-dose radiation that doesn't penetrate very far. It doesn't travel very far.
So the radiation stays in the immediate area. Over time, the tiles become absorbed into the brain, so there is no need to have a follow-up surgery to remove them. According to medical experts, more than 200,000 people a year are diagnosed with some form of brain cancer, and more than half of those patients who are treated find out their tumor grew back within the same year, despite aggressive therapies. In a clinical study, gamma tile therapy extended the time of a tumor reemerging with limited side effects. But Dr. Horowitz says there are some patients who would not qualify for gamma tile therapy due to the location of the tumor.
A patient who has a tumor that I don't believe, or a surgeon doesn't believe they can remove 90% or more of it. A tumor that is in the brainstem often will not be eligible for this because we don't want to give this radiation to the brainstem. Or a tumor that's that's too close to the optic nerve.
Right now, the only hospital in our immediate area that offers this gamma tile therapy is Orange Park Hospital. However, I have been told that the Mayo Clinic and Baptist Health will soon get on board to start offering the same services. Reporting live, Eric Avane, Channel 4, the local station.